been very successful at that. I think that's a big part of why we're seeing both the number of cases and the number of hospitalizations and deaths go down. We're very happy with that. Our numbers are looking pretty good. We still have a 4.7% positive test rate. We still have, quite a number of cases coming. So we're not out of the woods yet, but we are definitely making a lot of progress. And especially for the most serious outcomes, I think we're doing quite well. That said, we're still working on getting folks vaccinated. 45% have gotten at least one shot in South Carolina. That's not where we want to be. So we are working on that. A couple things we're working on. We are working on getting the 12 to 15-year-olds vaccinated because they just became eligible yesterday. So we are actively working with Superintendent Spearman in the Department of Education and with all the school districts, trying to offer as many vaccine clinics in the schools before they let out for summer as we can, actually with parental consent, but we are moving very fast on that because we only have 2 to 3 weeks, of course. And then obviously setting up other opportunities for that age group to get vaccinated. One of the big things we're focusing on now is rather than doing vaccine events, doing vaccine ad events. So we are going to be in some of the state parks on the weekend, starting Memorial Day weekend. We're working with Director Parrish from the State Parks Directorate and working on, maybe potentially giving folks free admission to the state park if you come in and get your vaccine for the day. So I think that'll be a positive. We're also going to be going out to a lot of fairs and festivals and that sort of thing and have a vaccine table there. Knowing there's really going to be a lot of folks there, they can come in and get their vaccine while they're at the fair or the festival. So that's going to be one of our new approaches. We're also looking at contracting, putting out a request for contracts for more mobile units to actually go out into the communities almost street by street, offering people vaccine right where they are, in the goal of getting as many folks the vaccine as we can. There will be some people that say no, and that's fine. But we want to try to make everybody have the opportunity to get the vaccine as easily as possible. It's just coming out their front door. So that is our goal. As you know, the masking has been an issue. The governor issued an order earlier this week, basically prohibiting mask mandates based on his previous orders, and also saying that parents have the opportunity to opt out of mask requirements in schools. Certainly our guidance is that masks are still helpful. Masks still prevent disease. We strongly recommend that communities retain mask mandates to the degree that they can, and that children in schools continue to wear their masks. We did, as directed, create an opt-out form, which is on our website, for children to opt out of wearing masks in schools. But it clearly says that if you do that, you're accepting all the liability as a parent. And we strongly recommend mask wearing through the end of the school year, with the hope then that we will not have to do that next school year. That's our goal. So that's kind of where we are at with COVID. We continue to have the FEMA site in Columbia. If you came in on I-26, you saw the signs for that. Still doing a couple hundred folks a day there, so we're happy with that. We're going to be having an hour on SCE-TV, the statewide public television service, on the 20th, talking about vaccines and having some roundtables and things that people can watch and learn more about the vaccines. We're also working with numerous community organizations, setting up new vaccine clinics across the state. In churches, we're working with the AME Church, we're working with the NAACP, we're working with various groups that have mobile units. Again, trying to get the vaccine out where folks are and using trusted local leaders to help promote the vaccine. So that's a short version of our efforts on COVID. You know the vaccines are slowing. We are not using all of our allocation at this point. We just got told nationwide there will be no Janssen vaccine for the next 2 to 3 weeks. Not entirely clear why. Because we're really depending on Janssen vaccine moving forward, especially as we go out to harder to reach populations. Being able to have a single dose vaccine helps. But we have enough COVID vaccines from Moderna and Pfizer in stock right now to do the 12 to 15-year-olds with the Pfizer and use Moderna for others. So we're going to keep vaccinating, but we're really hoping to get more Janssen as soon as we can. So that's where we are with COVID right now. Let me stop there and see if there's any questions on the COVID piece before I move on. Yes, sir.
I guess you have hesitancy and then you have access. Do we have a sense of whether one is a larger problem than the other?
I think, and this is somewhat anecdotal, I think hesitancy is our bigger issue now. There is still an access issue, to be sure. In some of our communities, especially the rural areas, it's still hard to get to the vaccine. That's why we want mobile units literally driving down every street we possibly can, offering vaccine, and doing it through the churches and that. But I think hesitancy is becoming a bigger issue for us. There's two groups that we see mostly with the hesitancy. One is young folks, 18 to 35, especially African Americans, 18 to 35. There's a significant hesitancy there. Some of that I think is just they don't think they need it. They don't see it as a risk to them. So we're working on that. The other is conservative, individual politically conservative. There is some hesitancy there. There's some natural distrust of government anyway, and they see this as a government program. So we're working with some things there, again, working with local community leaders that they will hopefully trust to try to get more vaccine into those folks.
Thank you.
Welcome. Yes, Mr. Lee.
A couple of questions. I see the number of tests is declining precipitously.
Yes.
So is there a plan for a wind down to reduce the total number of test sites to reflect the really very, very small usage that I'm seeing in some of the ones I'm familiar with?
We are already winding. We've already reduced the number of testing sites. We are going to gradually continue to decrease that. There is certainly still a role for testing. Testing is still important. But we do anticipate fewer and fewer testing sites as we go along. And that'll be a gradual decline over the next couple of months, yes.
And with regards to the setup of the clinics, I have been looking at the numbers associated with the expectations for a clinic versus the numbers that actually show up.
Yes.
And I think it's probably pretty safe to say that we're not hitting our targets that we had hoped we would hit at the clinics.
Yes.
So continuing to do clinics, are we going to be able to change the methodology that we use for recruiting folks to come and get vaccinated? Or, I mean, I was reading, we were just talking of, I guess somebody in Ohio is giving lottery tickets, or one idea that came up was the possibility in an area that's underserved to get for the communities to have a competition, and whoever gets the greatest number or the greatest increase gets recreation equipment for their parks, or something along those lines, so that the folks who are local take ownership and have skin in the game.
Yeah, absolutely. I think we're changing two things. One is we're getting away from vaccine events like the FEMA clinic. The FEMA clinic's great, and it's doing okay. But that's why I said we want vaccines at events. Where we want to have a vaccine table where people already are, whether that's a state park on a holiday weekend, whether that's a fair or a festival. We think, if you're walking by and you see the table, and we say, hey, do you want the vaccine? That's our chance to get you and give you that vaccine, and then you're probably going to be there for 15 minutes anyway. So we think that's a great opportunity to get folks where they are. I do think we are looking at incentives. Free admission to a state park, that's not a huge incentive, but it's something. There are some legal restraints on what we can do incentive-wise. There were some proposals in the recent budget proposal. Those did not pass. But we are certainly looking at what we legally can do, whether that's, giving reduced price admission to somewhere, maybe partnering with a company or a restaurant or something. So we are certainly looking at, can we partner with private organizations to give some sort of benefit, whether that's, maybe a discount on food or something, to encourage folks to get the vaccine at that location. And of course that then drives, business to that location. So it's benefit to them too. So yes, we are certainly looking at that. We don't have a lot in place yet, but we are actively trying to grow that idea.
Well, I don't think South Carolina is the only place that has this phenomenon. No. So we ought to try to reach out to anybody else who's identified a successful methodology, have a look at those as well.
Yes. West Virginia is giving $100 savings bonds to those under 35 who get the vaccine. We're tracking to see what their results are. Kind of mixed right now, but we're certainly talking with them. And there are a couple of places, there are some places where, for example, in Washington, D.C., they had a, get a shot, get a beer arrangement. And that's literally, they partnered with local establishments and did that. And so we're talking with them to see what kind of results they have. We're open to almost anything that will encourage folks to get the vaccine, and that's legal.
Thank you.
Yes, sir. And let me just give you a shout out, sir. Congratulations. I know your clinic just gave its 50,000th vaccine. So very well done.
Thank you.
I have a question.
Yes.
We all know that what's going on in India, and from what I understand, that variant's been detected in the Northeast here in the United States. What the current vaccines that are being distributed, does it cover that variant? And if not, what are we doing as a state to be ready in case that variant starts coming down?
We think we do have some of that variant here, first of all, in South Carolina. And we do think the current vaccines cover it. It does transmit more easily, but it does appear to be susceptible to the vaccine. So that's the good news. But certainly we're tracking that. We have plans in place. If for some reason we did see a surge, we're watching those numbers very carefully. If there was, a different variant, for example, that came out and was not susceptible to the vaccines, then obviously we need to go back to masks and all the precautions that we still recommend for that very reason. But you can probably double down on those. We have a long list of folks that offer treatment for COVID still, because we still have 300 and some people in the hospital for COVID today. So we definitely are ready to ramp up treatment if we would need it. Hoping not, but yes, we are definitely ready in case that requirement does come back.
Thank you.
Okay. All right, well then let me quickly move on to some environmental issues that we are facing. First of all, you may know that earlier this week we issued an order to the New Indy paperboard company in Catawba, South Carolina, near the border with North Carolina. This is a facility that makes paper. About 3 months ago now, in February, they switched from making office-type paper, white paper, to brown paper, things that go into cardboard and shopping bags, that sort of thing. And in the process of that change, they are now releasing far more hydrogen sulfide into the community than they used to. Hydrogen sulfide, although you have to take a lot of it in to really do serious physical harm, it's very nauseating and annoying, and it's not something you want to have to breathe. And these folks that are now living around the plant, they have it 24/7. It's in their houses, it's outside in their yards. It's really changing their quality of life, and it is causing physical harm. We've done a lot of work, Byra and her team, working with the EPA. We have confirmed that plant is the source of the hydrogen sulfide that we're seeing. There was some dispute about that, but they are clearly the source. We've been able to track that back. We know that they turned off some of their air strippers that might have reduced this back in February. They have turned at least one of those back on. But we are still working with the EPA. We issued them an order earlier this week directing that they cease and desist the increased emissions or that they stop functioning until they can fix it. There's also concerns with their water. They have a big wastewater system there that we're also concerned with, that we think may be contributing to the problem significantly. So we've asked them to look at that. And basically they have to have an action plan to us by June 15th at the latest. And I believe the EPA may also be taking some action. We're waiting to see about that. But obviously we've really given them the clear message. They've got to clean up their act. They've got to make things better for the people out there. It's also going across the border to North Carolina, so we're talking with North Carolina here too. But clearly a major issue for a lot of people up there. I think we got 17,000 complaints, if I'm remembering right. And, that's a lot of complaints. That's a lot of people being affected. So we are working very closely with that. We'll be keeping the public informed and really trying to take a quick action, science-based. We have all the evidence now that we need to really try to make the place better for the people that live up there.
What kind of penalties can be incurred if they don't meet the June whatever date?
Well, basically, and Myra, jump in here. Myra's over there, and she's the one that's done all the great work on this. But basically, the order says cease and desist. We can shut them down.
Okay.
That we don't want to, because that puts people out of work. But if they don't do what they need to do, then that is one possible step. We can also fine them. But I think shutting them down would probably be the step that would be the final step if we had to.
And you said that they only turned on one air filter. I don't remember the exact filter you said, but they had turned a stripper, and they shut off a couple of them. How come they haven't turned on all of them?
We've certainly asked them to take mitigation efforts. That could be part of their plan. I think it should be. It's something they could easily do. But we'll let them come up with the plan. They have to convince us they have a plan that will work, and then implement it. We got to see change.
Thank you.
Have we had discussions with people in North Carolina, since they seem to be looking up to get?
Yes, we have talked with the governor up there, and we've talked with the health director in North Carolina. Yes.
And are they participating in the arrangement of this company?
Well, they can't penalize the company because the company's not in North Carolina, but we are certainly keeping them well informed and, working with them to make sure that their citizens' issues are addressed too.
So do you think you have their attention? Are they working with you at this point?
I think we have their attention. I think working with us remains to be seen.
Okay.
We're waiting on a response to the order right now.
All right.
I'm hopeful, but I won't say yes yet.
When was the order issued?
That was Tuesday, wasn't it?
It was actually, I believe it went into the mail over the weekend.
Okay.
Last week.
Yeah, last weekend, so they probably got it by Tuesday. Yeah.
You have not heard anything from them?
No, Myra, we've not, as of this morning, we have not, correct?
No, sir.
Yeah, no, we have not.
Is that a good sign or a bad sign?
They have 15 days. So, it's early. I wouldn't say it's a good sign.
So have we done any testing? The Catawba River is right there, and they use the water as part of their process, and they discharge into the river as well. Have we done any testing to see if there's any impact downstream?
Myra?
Yes, sir. We do, in addition to our routine sampling and monitoring that we do of the Catawba River, we have initiated a special study. And we're working with the Catawba River Keeper and some of the other partners that we have that help us, provide oversight of the quality of water in the Catawba. So we're initiating a very intense special study.
As always, Myra's on top of it. Thank you.
Of course she is. Yes, absolutely.
Myra, is the Catawba Indian Nation involved?
Yes, sir. I'm glad you brought that up because that was a big concern for us and EPA that they were being impacted as well. And we have a great partnership with the Catawba Indian Nation. In fact, they are partnering with us with some air quality monitoring. So we've been very fortunate that we've got some great partners at the table with us. And I do want to say that this is very unique. The fact that we have over 17,600 reports of odor, but how we set this up, we set up a citizen portal to where the citizens were part of the investigation with us. They reported, gave us very detailed information about where they were detecting the odor, what the characteristics were, and we pulled from that database, and that informed the direction and the approaches that we took. And Dr. Simmer, I do want to say that EPA, just in the last hour, has taken action.
Okay.
EPA has authority under the Clean Air Act. It's not delegated to states. And so they've got a couple of orders that just recently came out under 303 and a request for information under Section 114. And basically, it's a 60-day order that says they have to reduce their hydrogen sulfide levels at the fence line of the facility.
Well, that ought to do it.
We certainly hope so.
Yeah.
Yes.
It's a shame to see when companies don't take being a steward of the environment seriously, right?
Yes.
And we've done a good job as South Carolinians protecting our environment. Very good job, and our whole department has. So especially Myra's department. That's just a shame, and that those poor people around there shouldn't have to sustain that.
And especially in a situation like this where it's having such a dramatic impact on so many people's quality of life.
Yeah.
Yeah. So we will keep you updated on what happens with that. Moving on to hurricane preparation, obviously 'tis the season. And so we're doing a lot of work in that. We recently had the governor's hurricane seminar where we got together with the other agencies and mapped out our plans for the year. I think that went very well. We're addressing hurricane preparation in several ways. One is that we're doing a longer term effort towards flood control. We're involved with flood control because a lot of times flood control has environmental impacts. And especially right now, there's a lot of issues along the coast with outflow channels, drainage channels, basically, that have not been cleaned in a long time. They vegetate over, and now that becomes a marsh. And obviously, if you change a marsh, that's an environmental issue. So what we're working with, I've met with, and Myra and I have met with representatives from the city of Charleston, where this is a big issue, obviously, and they have a lot of flooding issues. But we're also working with other communities along the coast and the legislature to give a one-time exemption for outflow channel clearing. And basically what we're proposing is that they're allowed to clear the channel back to what it was. They can't make it larger, they can't change it, but they can clean it out and give them a certain period of time to be able to do that. And then they can maintain that channel. They have to agree to maintain that channel at least every 7 years so we don't end up back here. I met with a number of residents in Charleston whose neighborhood floods repeatedly, and the reason it's flooding is because the outflow channel is blocked. And because they need a permit to clean it now because it's been blocked for 20 years. Now, of course, it's been blocked for 20 years because nobody cleaned it. So we're working on giving them this one-time opportunity to really get all these things caught back up and then keep them there. We're hoping that'll significantly mitigate the flooding issues in many of the residential areas of the coast. And like I say, we're working with the legislature to get the legislative approvals for that as well. And I think we'll have a favorable outcome on that. Obviously, hurricane preparation.
Is it the city of Charleston or is it Mount Pleasant or?
The group we met with City of Charleston, but many other communities are going to benefit from this too. Yeah. And it also was all Charleston County, with both county and the city. So from the medical standpoint for hurricane preparation, we're working with the Hospital Association and the hospitals across the state to make sure they're ready. One thing we're changing a little bit this year compared to previous years is we're allowing the hospital to have the option of keeping some staff on board. In the past, hospital staff had to evacuate like everybody else in front of the evacuation order. So we're working with the hospital to set it up so that if they believe they can keep their staff safely, they have a part of the hospital where they'll be safe. And even already, if they have an unstable patient they can't move, they keep them anyway. With the intent that this way the hospital will be able to reopen as soon as the immediate threat is passed. They don't have to wait for the evacuation order to be lifted to get their staff back in. So they can start doing urgent and emergent care as soon as the immediate threat is passed. We think this will help because we know, 50, 60% of folks don't evacuate. They should, but they don't. And they need medical care a lot of times immediately after. And right now there's nowhere for them to go. So that's why we're trying to have medical care available much quicker than we have in the past. And so that's one change that we're working. The hospitals support that. So we think we'll be able to make that happen. We'll just include that in the governor's order if there is the need for an evacuation order from the governor. Patients will still be evacuated. It won't change patient care at all. Patients will still be evacuated safely. So that won't change. But we're allowing them to have the option of keeping some core staff behind, exempt from the evacuation order. And finally, we were also, and kudos to Myra and her team on this, we're working on an environmental justice project in North Charleston related to hurricanes. That's an area, it's an area that has typically not gotten a lot of attention, but they have flooding issues up there. It's underserved in many ways. So we're working very actively with them to help them prepare for hurricanes, to give them the resources they need. Something that hasn't happened in the past. So I'm very pleased with that, and I think that's going very well, and I think will give us dividends if a hurricane should come through that way this season.
Are you working with the city of North Charleston?
Yes, we are. Yep. Okay. Any questions on environmental issues? Okay. Then one issue. I'm sorry, go ahead. Somebody.
I was going to say, I've got one question, but I'm not sure where it falls. So if you've got more to say, I'll wait.
So I'm almost done. Sorry. I'm going to move on to healthcare quality, which might be something that probably is maybe of issue, maybe your issue, I think. But on the healthcare quality side, one big issue we're working is the non-nurse midwife regulations. The initial regulations were sent back by the Senate for revision. We decided to pull them because we did not have time to get them through this session and resubmit for next year. But in the meantime, as I dug into that, what I determined was, I'm very focused on healthcare quality. We don't have the data to know, are they providing quality care or not? They may be, but we don't know. So we are currently, and working with Gwen and her team, we have now a draft, and we'll share this with you shortly. We got a little more work to do on it. But basically, of data that we want to collect on every delivery, either done by a midwife or started by a midwife and finished in a hospital, because we don't collect any data on the ones that the midwife starts but end up in a hospital. But those are very important. So we're working on collecting much more comprehensive data than we have in the past, ensuring that we actually get the data, because right now, a lot of times we don't. Then using that information to determine, is quality care being provided? If so, then that's great. And then we'll move forward with the regulation with some changes. If it's not, then we're going to work with the midwives to work on improving that. We've talked with them. I'm going to be going to the midwife advisory group coming up here later this month and talking about this very issue and the data points that we are planning on collecting. And we've determined that we have the authority internally to collect this data based on existing law and regulation, so we don't need a new regulation or law to do that. And we'll be hopefully putting this out and starting to collect the data here no later than July 1st. That's our goal. So that's what's moving on that front. And then the other issue, and Mr. Kane is maybe getting to what you wanted to talk about, we are tracking, at the governor's request, nursing home and long-term care facility visitation rates. during COVID. There's been a big push to make sure that people can visit their loved ones in these facilities, because we know that when they can't, certainly for the individual in the facility, that can have very negative effects, both mental health wise and actually has negative physical effects too. But it's also important for the family and the loved ones. So I will say we're very pleased. Right now we are consistently every week well above 90% are open for indoor visitation, which is what we wanted. We do have a few though that are chronic non-reporters, and we do penalize those who don't report. I know there's some concern about that. The facilities have expressed some concern about having to continue to report. So we are looking at that. We are looking at, what level the penalty should be assessed at. On the other hand, the good news is the vast majority are complying, are doing what they should do. So it's a relatively small number that we have a problem with. But Mr. Kinney, I'm not sure that's what you wanted to ask about, but let me stop there and see what your question was, sir.
I certainly appreciate you bringing it up, because that is a concern of mine, and I was going to address it. But I was going to go back to the Blue Ribbon panel.
Yes, sir.
And the fact that at the last meeting, I think I even made the motion based on the minutes to approve that and move forward. But if I remember in our discussions, you were going to reach out to some of the board members for recommendations for people to serve on that panel.
Yes.
And I don't know that that's occurred. It certainly hasn't occurred with me. And I was wondering if that has already happened or if you intend on doing it. Just curious.
Okay. I actually did talk with several board members. I thought everyone had been reached out to and given the opportunity, but if not, I apologize. We certainly can still take suggestions. The membership is not finalized, so if anyone has suggestions, please feel free to send those to me or give me a call, and we will definitely take those.
Okay. The other thing is about the fines and penalties for nursing facilities failing to report timely. That's been an issue with me for some time. It's the only healthcare industry in the state that is being fined for reporting, not for quality care issues. This does not involve quality care. This involves reporting visitation. The governor's order required the reporting. We as DHEC decided in order to see that it was done, we would place fines on those. I don't know, unless you can clarify for me, any other healthcare industry is being fined for reporting. I know we'll have reports here that they got fined, but usually they're for quality or operational issues, not related to reportables. So if I don't report by 5 o'clock on Monday, I'm going to be fined. I just think that that's very punitive. I think the staff has been put in a situation where they have to do it, and I'm sure there'll be further discussion on it later. But I'm very passionate about this, and I will continue to bring it up until we've done something about it. I don't understand why something can't be done now. Looking into it is a good word, but it doesn't show action. Thank you.
I have to say I support him in his perspective. We have 38 different community care facilities that were fined this month. We have 4 RFR hearings scheduled, I believe, for today. I've got 2 of them in here that were fined $1,000 for this. A lot of these facilities are family-run, small, 5-6 bed type facilities. And I don't believe the staff has any flexibility whatsoever with regards to the fines. Personally, I support, the governor wants the reports, that's fine. We'll try to get everybody to give them to us, but I don't believe that this is beneficial to our relations with these organizations. And given the late point at which we are now in the COVID response, frankly, I don't think the fines are merited. So I'm not sure at what point, when do we declare victory and do away with these fines? How long does it go on?
There is an escalating series of fines. And Gwen, please jump in here. But there's an escalating series of fines so that, the first time you don't report, you don't get a big fine. So if you're getting $1,000, that means you've not reported on multiple occasions. But we can certainly discuss, if the board feels that the fines are excessive or we should make them smaller, we can certainly discuss that.
Frankly,
I think we ought to remove.
Yeah, I do too.
We ought to what?
Remove them.
remove the fines. Nobody else is being fined for reporting. And all healthcare agencies are having to report to DHEC. If they're not timely, are they fined? They are not fined. There's nothing saying they will be fined if they fail to report time. Or either deadlines have not been put on them like they have been on long-term healthcare facilities. And some of these groups are so small, it is having a tremendous impact on them.
In what way?
I don't think he heard you.
Sonny, in what way? What's the impact?
The financial staff that are having to do just about everything, and they're being impacted by this. And I'll tell you, they're not wanting to spend $100 to challenge an RFR. They don't want. They just don't think it's right. And it's not unless you can show me where we're doing it somewhere else. Did we have to do this with hospitals? Have we had to do it with pharmacies? I don't know.
Ask a question.
It's not right. It is not right.
Is it Gwen that, where's Gwen?
Yeah, healthcare quality, yes.
Oh, thanks. I can't see over the, I'm short, sorry.
Right.
How many times do you have to miss reporting to get to this $1,000 fine?
You're at time number 4. And and there will be a presentation later at the RFR.
Mm-hmm.
But on behalf of the agency and HQ, I understand the concern. When we initially began the penalties phase, we first said, let's report. We gave them a grace period, realized there may be some difficulties in doing this, and so we began to do a webinar. Let's contact these facilities. We don't want them to not report because they don't understand. So we did webinars. If we had some who were beginning to get to a repeat situation, we called these facilities. So I don't want you to think that we started out with this basic penalty. So to answer you, the first time is $250. To help us, we give them a reminder email on Friday. On Friday we say, okay, don't forget, on Monday you need to report. On Monday, we still send another reminder out that says, don't forget, you need to report. So we understood that this could be a problem, but it didn't change the fact that the order stated we need to report. We need to understand visitation. When we initially began the visitation, we were concerned because we thought facilities didn't understand. They didn't. They didn't understand, when do you allow the visitation? What is the testing issue? So we spent a great deal of time calling facilities, a great deal of time trying to educate them. So first offense is $250. We set it at $250 because the way the order reads, it could be up to $1,000 a day. So we went with $250, enough hopefully to deter them and have them report. So we said $250. In most cases, once you got the first $250, most of them started reporting. But if you didn't, then the next time it went up to $350, then $450, and then $1,000. So the answer, you're at 4 times.
And Gwen, for most of these facilities, it's a very straightforward report. You say yes or no. Yes, you're open. No, then you got to tell us why. If it's yes, you just send us to yes and you're done.
It is a very simple process. The form is on there. You tap a button, you scroll down, you can find your facility name. Everything you need to tell us 2 questions. Yes, I'm allowing visitation, no, I'm not. If you say no, there's 2 choices why you're not allowing.
Hey, Sonny, can I ask you a question?
Sure.
Yeah, hey, when these companies or your constituents are reaching out to you, what are they telling you why they can't get that yes or no question completed?
Well, the ones we've seen said that they didn't get the reminder notification. And we're not talking about a facility like my mother's in, which is 290 beds. Of course, the census, COVID has killed the census. It's about 220, I think. But we're not talking about those. We're talking about the smaller operations that have maybe 4 people working there. And they're failing to do this, and they're being hit with these large fines that are pretty impactful, particularly if they're 11-bed facilities. And this census, the COVID has had an impact on them like it has had on the others. They may only have 3 or 4 residents there. and they may only have one visit a week, and they may have no COVID at all in the facilities. So it's just the impact of it. These facilities continued to be surveyed. The nursing facilities continued to be surveyed even during COVID. They were required to test their employees twice a week and residents once a week. The facility that I go in to see my mother, they test my temperature when I go in. They ask me, and I have to produce my card showing I've been vaccinated. I'm restricted to where I go, but I can visit with mother in a room. We can walk outside. I mean, they're doing a great job under the circumstances that they're in. But why are we penalizing them for failure to report timely? Now, if they're not reporting at all, we need to do something. But I think that some of them are just not hitting that 5 o'clock deadline. And I think fines are wrong, particularly on that industry. They're taking care of our loved ones. During this pandemic, they have not only been the caregiver, but they've been the family of the patients because we could not allow visitation. And so they've been both, and now we're just popping them. I just don't understand that. I don't understand why we're doing that for that population of folks. They've done a tremendous job. And I saw the notice about hospital week. It's nursing home week this week, too, I think. They've done a tremendous job. So,
So what would you have us say?
I think it's wrong, and I think they need to be removed. That's what I think. We're not penalizing anybody else for failure to report timely.
Director Simmer, is your report concluded? I don't want to interrupt you.
The only thing I was going to let you know is that there have been some requests for more information to the board, so we will be doing that. So pretty much anything of significance that happens in your district, we'll make sure you know about as soon as possible. So just to let you know, you'll be getting some more communication from us going forward. And that concludes my report.
So, Mr. Chairman, I move that the board go into executive session for legal advice related to the visitation reporting order. For nursing homes.
Second.
All those in favor, yea?
Aye.
And now? Do you want to do it now?
Okay, I think we need to get this resolved before 4 RFRs come up.
For what?
We have 4 RFRs.
We have several seasons.